Can you hear me? I just want to make sure. Oh, it doesn't sound like it. So. Hello? Hello? Okay, so that is totally... Can you hear me now? I'm a little behind. Okay, what are we hearing now? We got to give it a little time here to... Oh, okay. Now I can hear it. All right, what did I do? Perfect. Cool. All right, I'm on my YouTube now, so I'm just going to see if I can see my chats. All right, I'm on my YouTube now, so I'm just going to see if I can see my chats. All right, I'm on my YouTube now, so I'm just going to see if I can see my chats. Awesome. Cool. All right. So I think I've got the sound a little bit figured out. I needed to turn off a bunch of things, and I think this is going to be where we need to be. So perfect. All right. Well, my name's Brandon. Welcome to the weekend review, and I just kind of want to start doing this to kind of build some following and hopefully get some good insight and good things out there. I hope to be able to interact with people as this kind of goes on, and yeah, I'm really excited. So I'm going to chat back to myself. Okay, and I'm going to see how long that takes to show up. Bam, right there. All right, I like how this works. Okay, and so I'm wanting to kind of do this every Monday if I can, around 8 o'clock my time, to just give a little weekly recap and just kind of talk. Maybe be able to have some interaction with folks. I'm trying to do things on Twitch as well, and just really kind of interested to see what kind of engagement I get, and just kind of continue on with that. So I don't know how long I'm going to be on doing this, but at a time. But I think it'll be kind of fun. I think it'll be a good time for me. At least it'll keep me accountable for my goals and what I want to do. And if this ends up being a segue to be able to do more podcast type things, bring people in once I figure out the equipment a lot better, hopefully get some good storylines, and just bring some people that we normally wouldn't have brought in to hear their stories. I think I really kind of like how Joe Rogan he's way more fluid and way more successful at doing this and has so many connections. But I just like how he's able to talk to individuals that he finds interesting and wants to get some more information. And I would like to do that, just kind of, even if it's just at a local level, to be able to highlight some good things that people are doing and the benefits that they can offer. I just would be awesome in that situation. So, all right, well, I'm just going to kind of highlight some of my week, maybe get to know me a little bit more. Hopefully you find that interesting and fun, and we'll, try to change things up as I get better at this. I hope to make more interesting content. I like doing my little Brandon's learning, 10-minute learnings with Brandon. I know they're not always at 10 minutes, but I thought it was kind of fun to have those kind of conversations, talks, and giving out some information, educational purposes, bring up some good things for people to engage with, talk about, and I don't know, again, just trying to help bring awareness of just different things, and I'm hoping that it'll be seen as good and beneficial, and that's where I am working on bringing out more of the positivity of this world and the things that are there. I know we'll definitely have some probably negative experiences, working at a hospital or even just your day-to-day interaction. Hopefully I can build somebody up, and they say a smile kind of goes a long way to help certain people, and that's kind of what I'm hoping, is just to lift somebody up one day and then be able to have them lift somebody else up, and that's kind of the plan. So just kind of had a spring break this last week. Didn't do a whole lot other than just hung out with the fam, doing things, and I worked, so it was, just kind of one of those normal things. We actually were able to enjoy some nice weather outside. We had probably a few days in the 60s. That was really good. Really enjoyed being outside and being able to wear shorts and not freeze to death. And I also bought a new compound bow that I've been wanting to get one for a while. So pulled the trigger. Definitely expensive, but so I'll have to work some extra shifts at the hospital to be able to get things turned around there. But been shooting it. It's been really nice compared to my old setup that I had. Just kind of some hand-me-downs, but they did the job. But what's going on? Oh yeah, so it was a Matthews Lift, is what it is. Super quiet, really smooth. Again, I've really enjoyed it. I did have kind of a little bit of an issue to where they call it the yoke part of it broke, or part of the string when I was pulling it back. So that was not the funnest, but got it fixed up. It's been shooting a little bit better. But coming with practice, shooting arrows, I've of course lost some. That's kind of the nature of the game. I'm not Cameron Haynes or John Dudley level anywhere close, and so I'm trying to get practice up, be able to be a little bit better and all that kind of stuff. So but yeah, so I'm just going to continue to practice, kind of work on those things, and it'll be all good. I was able to participate in my work. They decided to celebrate some of us nurses and also respiratory therapists, which I am, in having some of our above and beyond credentials. So they celebrated me having my NPS, which is neonatal pediatric specialist. I ended up taking a test. It's been 2-ish years now, and was able to pass that test to say that I have an increased knowledge of the neonatal and pediatric age and patient demographic, if you will. It's pretty, I was really excited to get it and do that, and so it was really nice that they highlighted us as individuals for that. So I'd kind of say kudos to them, and it really, I'm a few out of our respiratory department, which our department's not huge. I'd say like maybe 30 to 35 of us, but there's only a few of us that actually have these extra credentials. So I kind of find it kind of cool and nice to be recognized that way. They gave us this thing. I think I've showed it once already, but I got that. It's a water bottle, kind of fun. Looks like an oxygen tank, and this is like powdered green on there, so it's pretty awesome. I like it a lot. So I can probably leave it right there. Be kind of fun. And then they gave cupcakes, and then they had a little dinner. It's kind of a snack, if you will, kind of eat up. So again, it was nice that they recognized us and were willing to put that on for all those people. So like I said, kudos to them. Like I said as well, was doing some working, or I worked at the hospital, and not crazy eventful, but was able to take care of all variety of patients, babies up to elderly, geriatric, I guess you could say, and just was able to get people where they needed to go, if you will. One of the days I was in the ICU and actually ended up being quite busy compared to the rest of the hospital. For me, whenever I'm in the ICU, you get in, you get report from whoever was on nights or the shift before. You get kind of a brief history, what happened overnight, what settings people are on, if they're on anything extreme or not, any lab results that's beneficial, any radiology, so x-rays, kind of look at those for certain patients as well, and just kind of get an idea of what the day's going to be like. And then you go and do your first rounds of treatments, if you will, and checks. So you usually, and it'll kind of depend on the day, but usually kind of leave around 7:30 in the morning, go and take care of all my patients and see what respiratory things that they need to be done, modalities, and just checking to see if they need to get off of certain equipment like your CPAPs or your BiPAPs. And so that can take a little bit of time. And then we have after that what's called, this is also called rounds, It's the ICU multidisciplinary rounds, and that's where you have the doctor, you have nursing staff, you have case management, you have pharmacy, and dietitians are there as well. And then sometimes physical and occupational therapy is there. And you're sitting or standing, if you go room to room, and talking about each patient and a little bit more in depth of kind of what brought them there, what their diagnoses are, where we're trying to go with their care, what things we need to do, if there's anything that needs to change, and if we're trying to liberate them from different things. Because we're going to start a new thing. We're liberating our ventilator patients. So, but yeah, liberating them from different breathing, treatments, drugs, mechanical ventilation is kind of the biggest thing there. And yeah, so you do that, and depending on how many patients you have, that can last an hour and a half. And we were able to do that and get things kind of settled on, and then we actually ended up taking a few patients off of certain things. And so on our end, that kind of, we go do those procedures, taking things out, and then we have to clean our equipment and then put them back together so that we can use them for the next person that needs it. So we always have a backup of ventilators, BiPAPs, high flows, all the different things that we use to be able to help whoever needs it at that, usually emergent, So that, takes up a little bit of time. We had an overhead thing that we had to go take care of that ended up being just kind of a false alarm. So that was kind of nice. You get your heart rate up a little bit, but then you ended up going back down. And yeah, and then we did have to take an individual to go get some imaging done. So that takes time. You got to pack everything up, make sure you have everything in case something happens. All your emergency equipment, you go down, get the the imaging done, and then you got to take them back upstairs. And I think it took us about 45 minutes worth. And so it's just these little things that kind of add up. I was able to have one of the students that is at the local school, college, university, and she did amazing. We got some good students that are willing to listen, willing to learn, want to go kind of get their hands dirty, if you will. So that was really nice to have her around, and she was able to see a lot that way. Yeah, so that's kind of a day in the life a little bit of a respiratory therapist that's doing the ICU per se in our hospital. And but again, sometimes things can be really low key, and then other things can be super crazy. But all right, so I've also been rereading this book, and I've talked about it probably ad nauseum for some of you people, but the 85% Solution. And I listened to it on Audible first and just kind of whipped through it that way. And so now I'm just kind of taking a little bit of time and reading it and trying to get a little bit more information, writing notes and those kind of things, reflecting some, doing self-reflecting on what I need to do better. And unfortunately, there's always something that I need to do better, not necessarily everybody else. So it's kind of the thing that I'm looking on, is making sure that I am being accountable for Brandon, and trying to get things figured out that way. So again, I'd really highly recommend, if you're wondering, why things happen the way they do, and it's everybody else's fault, not yours fault. And buddy, I'm busy. What do you need? Okay. I love you. And yeah, so sorry, got a little interrupted, but I did want to read one of the quotes that I found that was kind of, I felt like, informational for me. All right, it's she did put in there, she said, "The more I am responsible for my actions and choices, the fewer failures I suffer, and the more success I enjoy." So I really kind of like that, and I'm hoping that by me putting myself out there and being willing to show forth some hard work, determination, that things are gonna turn around, and whatever that means, I think that's awesome. There's always going to be some door that'll open that will be able to sustain my life, and it's going to be good. I think it's going to be really fun. So, I just kind of wrote a couple of notes that I'm responsible for wanting other people to, want me and need me and all that kind of stuff. So, with that, I was actually making some posts on LinkedIn, and I've really gotten a lot of good information. I feel like a lot of good traction on LinkedIn, and there's a lot of like-minded people on there too, and just reinforces positivity. It's a great place to get any kind of golden nuggets that you can use in your personal life, your work life, and religious life, all those things. And so I've really kind of enjoyed kind of looking at that, getting into the weeds, not the weeds, but getting into the depth of that, and the LinkedIn learning part of it. It's amazing. There's so many good, awesome modules and information on there. So I would highly recommend that you take time to go check that out and look at it. So I guess while I'm kind of typing and looking here, yeah, I think it's, like I said, I think it's awesome. And it's also a great place to get some networking figured out, some professional career development, all sorts of opportunities. I guess a couple of other things here that I just like to take notes on every little thing. I talked to somebody about becoming or getting my private pilot's license, and I don't necessarily want to do that as a job, but I think that it'll open up a lot of different opportunities for me, and just being able to explore. I know my wife really wants to travel a little bit more, and I think it would be awesome to be able to take her on a date and go somewhere a little further than just driving the couple hours and still being in the same places all the time. I'd say it's just kind of, it was fun finding out about how long it can take. I think short amount of time, you can take 6 months all the way to a year, maybe a little bit longer. But the shorter amount of time that you take to do all the education, the flying practice, all that kind of stuff, it ends up being a little bit shorter for you, or that and cheaper and shorter if you can try to lump it in, do like 3 to 4 times a week versus like 1 to 2 times a week. So cost is definitely going to be a hurdle for us, so I'm going to have to figure out that part of it. But I think it could really, like I said, open up a lot of opportunities, and I've always kind of liked the idea of flying. It'd be a lot of fun. So I need to do a discovery flight just to see how well I handle all the flying and pressure and all that kind of stuff. But I think it would be a fun, awesome deal there. But so that's definitely something that's kind of in my mind, in the back burner, just thinking of different things. And yeah, so that was another thing I did this week. So yeah, I invite anybody that checks this out later or sees it, share your own highlights and experiences from the past week in the chat. I can highlight those and bring it up. I'd like to kind of respond to some of the viewers' comments and questions, and so just kind of like that interaction and that engagement. I think it'd be a lot of fun. And one thing that I've learned while going to school and being part of let me make sure I get it right, the National Society of Leadership and Success chapter, is that there is so many awesome things that happen with a group of people that have kind of a like-minded goal, if you will, like for us, becoming a better person, wanting to do good. There's a lot of different things that we can brainstorm and be able to figure things out, and it'd be a lot of fun. So please, if you're on here, I know I'm kind of talking to the void right now, and that's okay. That's kind of how you start things. You do things that are scary, put yourself out there, and that's what I'm doing. So I just want to be able to have good conversations and just kind of go that way. So yeah, thanks again for anybody that has taken any kind of engagement, any kind of connection with me, and I hope that we could be on a good learning curve together and figure some things out. And I want, and I'll get things better here on this end. I figured out the audio, I feel like, so hopefully it stayed well the rest of the time. And yeah, all right. So I'll see y'all later. And yeah, it shows me that I'm the only one on here, so that is awesome. But yeah, I'm gonna put some hearts, some 100%, because I can. But yeah. Okay. Well, everybody have a good night. We'll see ya.